Kelly, doctors say that the beginning of the pandemic really focused a lot on care for patients inside the hospital, but now they figured out how to better care for COVID survivors at their own homes. Eyes are on COVID patients 24 hours a day at the hospital, but doctors are finding ways to safely send them home, giving patients mobile tech and keeping watch from there.
And so if I can send you home with a pulse oximeter, some kind of biotechnology wearable, where I'm getting all that data, all those vital signs fed back to somebody 24 hours a day, and you don't need oxygen at the moment, maybe you can do that at home versus be in the hospital.
That helps free up hospital beds. The need for them is growing with the current COVID surge in Florida. Dr. Jason Wilson with Tampa General Hospital and USF Health says their setup to care for patients outside the hospital works.
We think right now probably 6 or 7 people are able to go home who probably would have been hospitalized before. And part of that's because we're able to give them supportive care and monitoring.
Better treatments for COVID patients help too. Inside the hospital, ICU patients now get remdesivir to fight the virus. And outside the emergency room, they use antibody shots.
We're getting those people who have higher risk set up for these therapeutic antibody infusions. Now, those work best for people who are older, over the age of 65, or maybe younger, but have what we call comorbidities, risk factors for having a worse outcome.
Doctors say a patient's needs can change at any moment once they leave, so they want several options to choose from.
And hopefully, as time goes on, we're going to see more and more of these kind of therapeutics start to materialize.
And Dr. Wilson says that there isn't much evidence right now showing what works for COVID patients outside of the hospital. So he says that they're going to continue to track their at-home treatments that they're doing so they know exactly what works. Kelly?
All right, that's good to know. Brianna Arredondo reporting for us tonight. Thank you, Brianna.